Hi, I'm Virginia, and welcome to the Health Creators Podcast, where we talk about the impact and business of being a health creator. I'm here today with Dr. Ally Jaffee. Thank you so much for being here today.
Thank you so much for having me. Great to connect.
Thank you. All right, let's get straight into it. So, who are you and what do you do?
So, hello everybody. I am an NHS junior doctor and I'm about to start next month my psychiatry training program to become a psychiatrist. And it's something that I've wanted to pursue since I was 14 and I'm now 28. So, a very long pipe dream that beautifully has all come together. And I wear quite a few different hats. I'm very passionate about having variety in my life. I really see it as a spice of life and something that helps my well-being. So I believe that there's so many transferable skills from healthcare, and which is why I just see it so fitting to wear multiple hats. So I'm also the co-founder of Nutri-Tank, which is a non-for-profit that I co-founded with Dr. Ian Broadley, where we met at Bristol Medical School 8 years ago now. And we are grant funded and have been on a mission to improve nutrition and lifestyle medicine education amongst healthcare professionals and students, because there is such a huge just avalanche of a gap in this sector, whereby in a 6-year medical degree, medical students can receive as little as 2 hours of nutrition education. And we know that poor diet is the leading cause of death and mortality worldwide. So there's this huge disconnect. It's in the NICE guidelines, first line management of nearly every chronic condition, offer patients diet and lifestyle advice. But our research showed that frontline clinicians were not in a position to do this. And we did a big national study with lots of collaborators that showed that it wasn't due to a lack of time as to why doctors weren't talking about nutrition and lifestyle, but actually it was due to a lack of confidence. And so how do you build confidence? You build confidence through rigorous training and education. So that's one of the hats I wear. I'm also a patient advocate and I have my own lived experience of mental illness, which I'm very open about. I experienced clinical depression 6 years ago now, halfway through medical school. And after I recovered, I really wanted to share my story with as many people as possible. And that's when I actually started my own content creation journey, which I'm sure we'll touch upon. As I really wanted to highlight that vulnerability can be strength, and that you can be a doctor and a patient, or a healthcare professional and a patient, a carer and a patient too. And I'm also a trustee of a wonderful grant giving charity called Chimo Trust. And we're on a mission to fund youth mental health charities targeting 10 to 25-year-olds across the UK who have interventions to help mental health that are around social interventions, sports interventions, nature interventions, and arts interventions, as we're really keen about getting young people back into communities, back into third spaces, third sectors. And we have funded such incredible charities, from non-contact boxing to surf therapy to nature therapy, and it's a great privilege to have this role. And finally, I'm a content creator, so everything that I get up to, you can all just see it online, as I am a bit of an oversharer.
Lovely. Thank you for sharing all of that. And it's so amazing to see everything that you're getting up to. And you are currently a junior doctor, which is amazing, because I think a lot of people create barriers for themselves by thinking that they haven't got enough experience, or they're not well educated enough, or they're still a student, and they're quite hesitant to get into the world of content creation. So you touched on a few reasons why you started creating health education videos and health education content. Do you want to expand on that?
Absolutely. And yeah, I really resonated with your point there. I think there are a lot of self-limiting beliefs when wanting to share your story online with the public. And you go through that whole internal monologue of, what will my friends think of me who aren't in this world? Will they find it cringy? Or what will my colleagues who I work with think of me if I'm spending my time on this? And so I think it's so important to be open about the journey and not just about the destination when you have loads of followers. And it's really great to see fellow content creators building what they're building, but in front of an audience. And so for me, I touched upon it, but I started my content creation journey just as I'd recovered from a bout of depression. And there was a stage where it was very touch and go whether I'd return to medical school or not. I had 2 years left to complete, and I became unwell when I was intercalating. So, taking a year out of clinical training to do a BSc in an area of my choice. So, I have a huge passion for the arts, and I love that medicine is an art and a science. And I probably lean towards the art side. And so, I was doing a BSc in medical humanities and creative arts at Imperial, and that's when things started to go a little bit south for me. And once I came out of that, and there's a whole conversation around how I got better, but once I came out the other side, and obviously it's not completely out of the other side, I'm a big believer in saying we're all a work in progress and recovery isn't linear. So just because I've reached a point of recovery, it doesn't mean I still don't have lows with my mental health, but I'm just have a greater sense of awareness now, which is what is so key to then know what your pain points are to then be able to reach out for help. So once I got through that and was technically on the other side, I really just wanted to share my story with as many medical students and healthcare professionals as possible to really challenge the stigma around being both a healthcare professional and a patient, and being able to really just be a role model as well for young people. As I felt when I was a young person, I never saw any of the leaders or mentors that I looked up to talking about their vulnerabilities, and I just saw it all as, they're perfect, they're on this pedestal, their lives are all together. I never really saw their low points being discussed or having had them discuss it with me. So I really wanted to be able to share my story from an educational perspective, but also from a perspective of you can't be what you can't see, and really shine a light on the fact that if you have a mental health condition or a chronic health condition and you want to apply for medical school, go ahead. You really should be able to challenge that self-limiting belief and show people that you can be definitely more than one thing.
Amazing. I love that. And I think it's I definitely 100% resonate with you can definitely be more than one thing, because I think they say that you have multiple careers over your lifetime, and the decision that you made at 16 when you wanted to be whatever career you chose at the time, you don't need to carry that forever, because you grow, you change, your interests change, you meet new people, you learn things that you wouldn't have had a clue existed at that age. So, you're making a decision with very limited information. So brilliant. So what impact have your health videos had so far? What kind of feedback or comments have you got on videos that you've created?
Absolutely. So I guess content creation, I should probably say, is split between myself and my personal brand, which is all about mental health advocacy, and then my non-for-profit Nutri-Tank. We have a great Instagram account, and we're on all other platforms as well. And we have loads and loads of educational webinars around nutrition and lifestyle medicine that are CPD accredited. So the impact of that has been very, very far-reaching. We have thousands of healthcare professionals and students signed up watching our webinars weekly and interacting with our content, and so many who have turned around and said, I wish I learned this in nursing school, I wish I learned this when I was in my early stages of being a physio, and this has helped me so much from a clinician self-care workforce well-being perspective. Therefore, I would love to share it with my patients. So we've really seen this ripple effect impact within the Nutri-Tank community of the education actually goes to the practitioner, and they can make the changes in their lifestyle, and then they are more likely to share them as an empowered individual with their patients. So we've seen that, and that's been really just incredibly, it's filled me with a lot of pride, and very proud of the team. It's obviously a huge team behind myself and my co-founders who's working on that content all the time, dietitians and registered nutritionists. And then from my personal brand content creation, I have really been able to receive some really heartwarming messages from a lot of young people, but actually also consultants, which is really interesting, who have really celebrated my openness and vulnerability online and said, thank you so much. I've been feeling all of these things too, and I've never been able to say it. And highlighting that we can be homogenized in the healthcare system and lose our individuality, the way you've expressed that, that's really helpful. And it's put a pin, it's pinpointed how I've been feeling, but I've not been able to articulate it. So it's been pretty extraordinary some of the feedback I've got from loads of different age ranges, but a lot of the feedback that really warms the cockles of my heart are from medical students or aspiring high school students who are wanting to apply. And I've recently received some really wonderful messages around saying like your words have provided so much comfort. It's truly reassuring to know it's normal and okay to fail. I do a lot around discussing failing exams and failing at applications. They replied saying, and the main thing is the conviction for what you want to do. And I'm going to save your message for later as it was so comforting. You have a good way with words. And I was like, wow, that's very kind. And it's just coming from, it's, everything I try and put online is very authentic, and I don't really ever post when I'm in my own kind of mental turmoil, because I think having boundaries with content creation is really, really important. So I always post after I've come out of something and I want to share it with my audience, but I also have boundaries of I don't have to share everything. And I do really enjoy sharing some of my own failures and it leading to conversations like this with people online or offline, where they have been able to open up to me and have seen that they're not at the end point of their journey. It's the classic cliched phrase, it's redirection rather than rejection. So really, really am heartwarmed by some of the messages that I receive.
That's really amazing. And I really like that you kind of have those messages to hand and they kind of help reassure you that, you are sharing something that's meaningful, that people are connecting with, and it's giving them something to move forward with kind of their decision making about what directions they want to go in life. And so you touched a little bit on your process to create health videos. So you said after you have kind of processed what you've been going through and you've got something to share. So do you want to kind of walk us through what that process looks like? So, you've got your ideation and then you've got your I don't know if you script anything and then you film it, edit it, and then publish it.
Yeah, I guess for me, I'd say I'm not as methodical as a lot of content creators out there. I'm a very creative person, and sometimes that can just culminate in just having an idea and running with it without a script. It's often not a method for me. It's just I get inspired and then I'll go online and create something. Other times I do a lot of repurposing of podcasts that I'm on, or I do a lot of public speaking at universities, schools, corporates about personal development and mental health. So I take a lot of the content that I'm quite opportunistic, and I think that's something I'd think is a good tip, is that if you are giving a talk somewhere, get someone to film it, because it's not always guaranteed that they'll film it. And so I'm quite opportunistic, thinking, okay, if I'm giving this talk, that will also be great. So that will be great for the audience that are witnessing it live, but it would also be amazing to repurpose that in a video form for later on one of the video platforms. So I kind of try and be as efficient as I can when thinking about content creation and it going far and wide, rather than it just being and serving for one purpose in one moment of time. I really try to create longevity and legacy with some of the content that I create, so that I can refer back to it if people want to book me for talks. I have it to hand to send it over. And it all stays relevant and people can access it at any time. So not particularly methodical, but I do keep on top of a lot of news articles, trends, mental health innovations that I find interesting, pop culture, representations of mental illness. For instance, I watch a lot of TV, film, and go to the theatre because, as I said, I'm really passionate about the arts. And for instance, recently I went to see a West End musical that storyline centered all about a mother with bipolar. And so having gone to see that production, I wanted to make content about it, so people can understand that there is starting to be more mainstream representation of severe mental illnesses like bipolar and schizophrenia, but also it means that they can go see the play themselves if they can afford to do so and can access it. So I do try and keep my finger on the pulse with what I live in London. I love taking advantage of the city of what I'm up to, what maybe my audience can benefit from, but also making it into like having a more meta angle on it and thinking about, well, what does this say about our understanding about mental health as well, and making commentaries on that.
I think that's really amazing in terms of a technique because I think a lot of stuff can happen in the media and some people don't know how to process it. And I think there can be a lot of misrepresentation of people as well. And so, you as an authority, you kind of describing that and providing that commentary is really, really valuable to your audience. And hopefully, that'll get a wide reach because when people see things in the media, again, you know, it's going to be something that is yesterday's story is kind of forgotten, but actually people will remember that and they'll carry that with them in future. So
Yeah.
it's important to have your
Mm.
content be kind of like evergreen. And when people see that you give that commentary, then they'll likely keep watching what you create because it'll become an
Hopefully.
expectation. Yeah.
I like to keep it current, but also I go off what my interests are. So, for
Yeah.
instance, I'm quite big on awareness days, and a lot of people have mixed opinions about them because it's
Mhm.
kind of, why are we just talking about this condition on this particular day when we should have awareness and education and accessible care around this condition all year round? So I completely take that point, and I'm a big critical thinker, and with a lot of my commentary on topics like, for instance, that theatre performance about bipolar, I always try and leave space for mixed opinions and commentary on my posts. And yes, I'll get some comments that don't necessarily align with my views, but I'm very interested in an open discussion and creating that non-judgmental space that everyone can say what their viewpoints are coming from their cultural perspective or whatever their lived experiences, blah blah blah. And so I do a lot around awareness days because I think it's a really important time where people's ears are pricked to what the topic is, whether it's um, World Suicide Prevention Day or World Schizophrenia Day. Those are the days that I tend to talk most about. And so I do try and be quite, that's when my content's quite planned. But then likewise, with having my finger on the pulse, I love commenting on what's new, and Inside Out 2 just came out. It's Disney Pixar's highest grossing animation, and it's all about emotional literacy and emotional health. So I thought, well, that's a brilliant post to create because it's on the forefront of people's minds and it's having a mass critical reception. So it's a real combination of what's happening in the outside world, awareness days, films coming out, etc., but also just keeping my audience up to date with what life as a junior doctor's like, what life as a founder's like, and taking them with me.
Yeah, I think also people love a point of familiarity as well. So they'll probably think, "Oh, well, yeah, I saw that movie," and
Mm.
it's really interesting to see different interpretations of it. Especially because when a big piece of content like that comes out, like a film, then it is the talk of the town for a while it's out, and then it's a great way to open a discussion on topics like mental health. So that's really really cool that you're doing that. So, what are your top tips for health creators who want to get started?
So I should probably have said at the start when I introduced myself, but I've just also qualified as a coach. So I've taken an F3 outside of clinical training, which is why I haven't started psychiatry straight away. And I've been training over the year as a transformational high performance life coach. And so I'm a big believer in challenging self-limiting beliefs. So I think that's the foundation of all content creation, because you have to have quite a good understanding of your own emotional health, because when you put yourself out there online, you need to be able to deal with uncertainty, deal with disappointment, not pin your identity on your posts for not getting the likes that you think it deserved based on the amount of effort you put in. So I think the kind of coaching and self-development piece for me is the foundation of all content creation, and something that I do advise on a fair bit, because I think that if you go in to content creation from a position of external validation, and this will fill my cup if I'm got loads of followers and you have all these conditional thinkings. When I hit 10k, when I hit this number of followers, I will feel worthy. I think that's a very dangerous trap to fall into. So I do encourage a lot of people to have awareness about your own emotional health and your own mental health and your own sense of self-worth, away from just anything to do with your professional life. Like, we're all just a person and human foremost, without any accolades or job description roles attached to that. So I say that's probably my first piece of advice. And then the second piece of advice would be create that community and join a community if there's already an existing one, because you can't be what you can't see, as I've alluded to before. And you really want to be in a space where you found your tribe. You can learn from people who are further along the journey of you, and they've been, doing YouTube for longer, so they can help you with thumbnails or all the kind of technical stuff, and to really learn from them, but also to just exchange ideas and then even collaborate on posts or podcasts like what we're doing today. I think that's my tip number 2 is really find your community and know that you're not alone. And there are so many healthcare content creators, and it's just becoming, a really exciting world where it's not on the fringes anymore. It's becoming the mainstream. And we know that young people, for instance, are getting so much of their health information from TikTok. So a lot of clinicians who may feel they're not tech proficient are thinking, well, I'd really like to reach my patients almost before they become my patients, with early intervention, with psycho information and preventative education around healthcare conditions. And then thirdly, I would just say, don't take yourself too seriously. I think perfection is the enemy of all good. I'm the furthest thing away from a perfectionist. I'm a bit of a I'm organized chaos, as I describe myself a lot of the time. And I would say that it's all about progress and not perfection. And content creation and growth in content creation really isn't linear either. You can be on an absolute winning streak, and then you can have a bit of quiet, and the algorithm changes and life happens to you, so you're not consistent with your contacts, or life happens for you, if I were reframing that, but and you're not consistent with your content, and that's all okay. Just aim for progress and just little bits of 1% improvements, rather than having some whole big grand plan that you have to execute straight away. I really think it's not to be cliched again, but it is quite tortoise over hare when it comes to content creation. It's a long game, and you can't just go viral. Some people do, and that's amazing. And is it luck? Is it really high skill that they've just managed to twig onto and get out there straight away? But it is quite an unpredictable space, so you just have to try your best and just fail fast and fail upwards. I've learned so much from what works and what doesn't work, and it doesn't define me either. If things fall really flatly, you just learn from it.
Yeah, I love that. I think it's so important to think about your emotional and mental well-being when you get into content creation, and don't set your expectations so high that you will never reach them, especially in a small period of time. And you need to define what success is for you as well. So
Yeah.
sometimes you'll post something and you'll get 2 likes, but maybe you've changed those 2 people's lives. So it's a
Mm.
measure of impact that you need to decide which makes sense for you.
It's really important to know your why as well, I think, before you start content creation. And of course, it can evolve over time. There's no problem with that. It doesn't have to be stuck in stone. But a lot of the time, most people's whys aren't, I want to get loads of followers and leave my job and be an influencer that lives of brand partnerships. A lot of the time, could be someone's why, but a lot of the time in the healthcare world, it's to do with greater impact around being able to affect change in people's health outside of the 4 walls of a hospital or clinic. And so I just think it's really good to have a bit of clarity on what your why is before starting your content creation journey. And obviously it can evolve over time as well. There can be flexibility.
Exactly. I think it's so important for your why to be big enough that you care about it and that it motivates you to keep going. Because if you use money as a motivator, then you'll never be satisfied, because you can have unlimited amount of money. But if you actually think about affecting and helping people with their health, or just improving their understanding so that they can feel more comfortable with something, that may be affecting themselves or affecting someone in their family or a friend. And so it's about connecting with people, I think. And health is a very personal thing that we all have. And sometimes there's a you have to constantly put the work in to maintain your health. You can't just have it. So I think it's important in the same way that health information is constantly evolving, that people's health beliefs are also evolving, and you
Absolutely.
are a point of authority that people will rely on for their health. So yeah, and any final words that you want to add?
I guess it's a slightly cynical and cautious final words is to whoever's listening, I just want them to be aware of the harms of health misinformation. And I know you're such a huge advocate for this, being part of the Patient Information Forum community. And for me, I'm very passionate about spreading the word to laymen, to the public, to patients, that be very aware of where you are consuming health information from, especially in the world of nutrition and mental health, where a lot of the time any person from the street can call themselves an expert, and there are a lot of unregulated professional titles. So nutritionist isn't regulated, coach isn't regulated, and well-being this and that and the other. So it's just very important to just be slightly discerning when you are consuming health related content, and be aware of some of the red flags of misinformation, and whether the content creator is trying to sell you something that sounds too good and they are actually trying to sell you something. So that was just kind of my last kind of bit of caution that I wanted to share. But I think it's an incredible time for us all, and it really democratizes health information. It increases accessibility. YouTube's work um, around social media as a determinant. What was the title of it? It was information as a determinant of health. That report that came out, and WHO's infodemic um, information and resources, it's an incredible time for information and how much we can access, but it's also a time to err with caution about where you're accessing it from and who you're accessing it from.
Yeah, really important to keep that in mind. Thank you for that. And yeah, I will leave all the links to Ally's things in the description box below, so you can see all of her stuff and check out Nutri-Tank as well. So do connect with Ally, especially if you want any coaching or any advice about becoming a health creator as well. And thank you so much for watching or listening, and we'll see you at the next episode.
Thank you so much for having me, Virginia.
A pleasure.